Hi friends, good evening and welcome back to my channel Mukambika Nursing. Friends, here we are discussing ESIC previous year questions and answers. Till now we completed 9 parts. All questions are from ESIC old question papers. Try to collect all previous year ESIC questions and solve it and study. That will be helpful for your exam preparation. Here we can discuss today's question. First question, common type of catheter is used in dash condition. Options, option A, retention of urine, option B, vacuum drainage, option C, vacuum extraction, option D, abortion. Common type of catheter is used in option D, abortion. This common type of catheter which is used for suction curettage in time of abortion. Okay, during the time of abortion it is used for suction and curettage. Option D is the correct answer. Move on to the next question. 32 years old mother with 30 weeks pregnancy have vaginal bleeding. What should do by the nurse first? Option A, apply pad. Option B, arrange for LSES. Option C, perform delivery. Option D, check fetal heart rate. Here question, 32 years old mother with 30 weeks gestation having vaginal bleeding. So as a nurse, what immediate or first priority action she should do? That is the question. So answer is option A, apply pad. Why we are using pad at first means to assess the amount of blood loss during bleeding. That is the topmost priority nursing action. Then we can do check fetal heart rate. And the next question, McDonald suturing is done in option A, missed abortion, option B, septic abortion, option C, recurrent abortion, option D, complete abortion. McDonald suturing is done in case of recurrent abortion. Option C is the correct answer. McDonald and Shirodkar suturing is performed at 40th week of gestation in case of a recurrent or habitual abortion. Okay, suppose in our question answer habitual abortion is there means that is also correct. Here recurrent is there, so recurrent is correct answer. Shirodkar and McDonald suturing is performed at 14th week of gestation. Okay, here option C is the correct answer. Next question, the cause of recurrent abortion in mid-trimester pregnancy includes option A, retroverted uterus, option B, cervical incompetence, option C, defective Mullerian fusion, option D, both A, B and C. Okay, the cause of recurrent abortion in mid-trimester pregnancy is cervical incompetence. Option B is the correct answer. Mid-trimester pregnancy means second trimester pregnancy is due to cervical incompetence. The next question, in the following, which symptom is not related in the classical triad of symptom of the tubal ectopic pregnancy? Option A, amenorrhea, option B, abdominal pain, option C, convulsions, option D, vaginal bleeding. Which is not the classical triad symptom of tubal ectopic pregnancy? Option C, convulsions is the correct answer. The classical symptoms of tubal ectopic pregnancy include amenorrhea. Amenorrhea means absence of menstruation followed by abdominal pain and vaginal bleeding. Here convulsions is not a sign of tubal ectopic pregnancy. Circlage or encircling cervix with suture is done for patient with which abortion or condition? Options, option A, complete abortion, option B, incomplete abortion, option C, incompetent cervix, option D, threatened abortion. Circlage is done for incompetent abortion. Option C is the correct answer. Encirclage or circlage is doing in case of cervical incompetence to prevent spontaneous abortion. Okay, it is used to prevent spontaneous abortion. The next question, an expected symptom of ruptured ectopic pregnancy would be options. Option A, high blood glucose level. Option B, sudden excruciating pain in the lower abdomen. Option C, severe bleeding. And option D, sign of shock. Question, expected symptom of ruptured ectopic pregnancy. Correct answer is option B, sudden excruciating pain in the lower abdomen. The main symptoms of ruptured ectopic pregnancy include acute agonizing and excruciating colicky pain in the lower abdomen, and also feeling of nausea and vomiting and vaginal bleeding. The next question, a rupture of tubal ectopic pregnancy is treated surgically by option. Option A, self-injectomy. Option B, oophorectomy. Option C, hysterectomy. And option D, vasectomy. Ruptured tubal ectopic pregnancy is treated surgically by self-injectomy. Option A is the correct answer. The next question, the alert symptoms of ectopic pregnancy are options. Option A, hyperemesis and weight loss. Option B, prolonged epigastric and copious vaginal discharge. Option C, abdominal pain, vaginal bleeding and positive pregnancy test. Option D, amenorrhea and negative pregnancy test. Question is, the alert sign of ectopic pregnancy is option C, abdominal pain, vaginal bleeding and positive pregnancy test. In the previous question, we already discussed the classical triad symptoms of ectopic pregnancy include amenorrhea, vaginal bleeding and abdominal pain. Okay, amenorrhea means absence of menstruation, that is positive pregnancy test. The next question, NDD should be given following RH positive delivery within options. Option A, 6 hours. Option B, 24 hours. Option C, 72 hours. And option D, 7 days. The NDD injection should be given after 72 hours following RH positive delivery. Option C is the correct answer. The next question, RH anti-D immunoglobulin is administered to mother following childbirth by which route? Options, option A, subcutaneous, option B, intradermal, option C, IV, option D, IM. Question, a route of administration of RH anti-D immunoglobulin. Correct answer is, it is IM. Option D is the correct answer. Move on to the next question. Prophylaxis of RH incompatibility is done by options. Option A, exchange transfusion in mother. Option B, administration of anti-D to child. Option C, exchange transfusion to child. Option D, administration of anti-D to mother. Correct answer is option D, administration of anti-D to mother. Prophylaxis of RH incompatibility is done by anti-D injection to mother. Option D is the correct answer. The next question, placental blood circulation is through options. Option A, villi. Option B, spiral arteries. Option C, chorionic membrane. Option D, umbilical arteries. Placental blood circulation is through spiral arteries. Option B is the correct answer. Move on to the next question. Outermost membrane of placenta is called options. Option A, amnion. Option B, yolk sac. Option C, chorion. Option D, cotyledon. Outermost membrane of placenta is called option C, chorion. Outermost membrane is chorion and innermost membrane is called amnion. Okay, here chorion is the correct answer. The next question, which is the inner layer of the fetal sac? Options, option A, amnion, option B, yolk sac, option C, chorion, option D, decidua. Outermost layer is chorion and innermost layer is called amnion. Option A is the correct answer. The next question, dash is the another term used for the umbilical cord. Options, option A, funix, option B, chorion, option C, amnion, option D, yolk sac. The another name of umbilical cord is funix. Option A is the correct answer. The next question, Common cause of infertility into females. Options: Option A, ovary dysfunction. Option B, hormonal imbalance. Option C, uterine abnormalities. Option D, pelvic inflammatory disease. Common cause of infertility into females is ovary dysfunction. Option A is the correct answer. The next question. Hysterosalpingography can diagnose all of the following except. Options: Option A, endometrial polyp. Option B, submucosal fibroid. Option C, subserous fibroid. Option D, uterine septum. Question. Hysterosalpingography is not possible in case of. Correct answer option C, subserous fibroid. Hysterosalpingography means it's a radiographic examination of uterus and oviduct. Okay, here in case of subserous fibroid, this fibroid is projected outside the uterus. So, with the help of this hysterosalpingography, we can't identify subserous fibroid. It is projected outside the uterus. The next question, commonest presentation of fetus at the onset of labor is. Options: Option A, podalic presentation. Option B, vertex presentation. Option C, shoulder presentation. Option D, face presentation. Commonest presentation is vertex presentation. Option B is the correct answer. And the next question and the last question in the series, vertex presentation of the fetus means. Options: Option A, head is towards the fundus of the uterus. Option B, head is unstable. Option C, head is towards the mother's pelvis. Option D, fetus is oblique in uterus. Vertex presentation of fetus means head is towards the mother's pelvis. Option C is the correct answer.